everyone. Welcome to a special episode of Living Well. We're doing things a little differently today as I am joined by Dr. Rubal Patel, a pulmonary and critical care specialist and member of the COVID-19 committee at Southwell. Dr. Patel is here with us today to help provide you with reliable information and help us learn a little bit more about COVID-19, which is a word that everyone in our world and community is all too familiar with right now. We know that when we are armed with reliable information, we can make a more informed decision to help make the best choices for ourselves and our loved ones. Dr. Patel and I are filming this while performing social distancing, a phrase I am sure many of us have never heard before a few weeks ago. Social distancing will not stop us from getting this information to you. Thank you, Dr. Patel, for joining us today. So last week, we posted on our social media outlets that if anybody wanted to, if they could sit down with a doctor or a specialist about COVID-19 and ask them their questions, what would they ask? And so that's what we're here today, is to ask you a lot of those questions and the things that we heard from our community. So could you share with us a little bit about your educational background before we get started?
Sure, Liza. So I went to medical school at Sable University School of Medicine. I did my residency and fellowship in pulmonary and critical care in Brooklyn, New York. And I've now been in Tifton, Georgia for about 10 years.
Okay, great. Well, we're so glad to have you today. So let's dive into our questions. We've got a lot, but we can get through those. And I think it'll be really, really great for our community to learn a little bit more. All right, so first question. What is coronavirus, COVID-19, or novel coronavirus? And are they all the same thing?
In general, they're all the same thing, just a different terminology for them. Coronavirus are a large group of viruses that typically infect the respiratory tract. 7 of them have been known to already infect humans. 4 of them we have seen seasonally, and they've been known to cause the common cold with mild symptoms. The new, we're also called novel coronavirus, was first found ever infected humans at the end of last year in China, 2019. And that's why the disease is called coronavirus disease 2019 or COVID-19.
So what are the symptoms of coronavirus?
So symptoms can vary from case to case. However, the most common symptoms that have been seen are fever and dry cough. Which have seen a majority of the patients. Right. Other symptoms such as shortness of breath, body aches, fatigue, even gastrointestinal symptoms like nausea, vomiting, diarrhea have been seen. Severe symptoms are less common.
It's officially pollen season. That's what I'm calling it, at least. So I know that people are getting a little nervous about the differentiation between symptoms of flu, cold, allergies, and COVID-19. So what is the difference between those symptoms?
Sure. So COVID-19, the common cold, and allergies can cause similar symptoms such as fever, cough, fatigue. However, there are certain symptoms that are more common to the cold or allergies. For instance, somebody with a cold may have more headaches, body aches, chills. Somebody with allergies may have more runny nose, stuffy nose, and sneezing, which may not be as common with COVID-19.
Before this reached the U.S., I heard a lot of people say, this is no worse than the flu. Is that true?
So, Liza, we're seeing that is not the case. Okay. We do have a larger number of flu cases, but these cases have occurred seasonally and over several months. COVID-19 has occurred in a short period of time, and the cases have exponentially grown and affected many countries. As compared to the flu, a patient with COVID-19 can spread it to 2 to 2.5 other people. Wow. The timing for how long one is infective is much longer, up to 14 days. Patients that are older have more complications and have a higher risk of death from COVID-19. In fact, the all-age case fatality for COVID-19 is even more than 10 times more than the flu. Therefore, COVID-19 not only is more contagious, but is contagious for a longer period of time than the flu. We currently have a vaccine every year for the flu. Yeah. We do not have a vaccine currently for COVID-19. We don't have any scientifically proven antiviral therapy for COVID-19 as we do for the flu.
So why does this virus in particular seem to be handled so differently than other ones that we've seen, like Ebola, swine flu, SARS?
The rate of spread of COVID-19 is far more rapid than the ones you mentioned.
Right.
In fact, the number of COVID-19 cases we have now actually exceed the number of cases we've had of SARS and Ebola in the United States.
What should somebody do if they think they're experiencing symptoms of COVID-19?
80% of patients have mild symptoms.
Yes.
And so if your symptoms are mild, your main goal is to help protect spreading this to your community and people in your home. So you want to stay home. Most patients can stay home and recover. However, you do want to note or be cognizant of the severe symptoms. If you're short of breath, if you have chest pain, confusion, then you may want to seek medical advice. You want to separate yourself from others in your home, a term called home isolation. Identify, say, if you can, a sick room. Okay. You want to limit contacts with others in your home, even pets. You want to limit visitors to your home. Want to wash your hands thoroughly.
Sure.
Of course, disinfect your home as possible. And you don't want to wear a face mask unless you have symptoms such as coughing, sneezing.
So wearing a face mask when you don't have symptoms is not going to prevent you from getting it. Is that correct?
That's true. I think, we are seeing a lot of people wearing face masks, more of a sense of protection. They feel like they're going to protect themselves. But the surgical face mask is really to contain the virus in somebody who is actually coughing or spreading it to everyone else. It doesn't really state, if you wear a mask, it doesn't guarantee that you're not going to get COVID-19.
So if I am sick and I have COVID-19, or I might think that I do, and my symptoms get worse, do I need to go to the hospital? Is that okay?
So obviously, if you are sick and if it's you've got some emergency signs like we mentioned, you definitely want to seek medical advice. You can go to the hospital, of course. However, before you go to the hospital, what we've advised our community to do is call a hotline that we've established at the hospital.
Yeah.
Call that hotline. That hotline, you can speak with somebody that can answer your questions. And if you need to be seen, they can direct you as to, guide you as to how to go about it. Before you go into a doctor's office or a hospital, you want to, if you wear a face mask, let them know that you are coming, so that our whole goal is to prevent spread of this virus.
Sure.
The number for the hotline, just so we can tell the community, it is 1-877-719-5787.
And that's 24/7.
That's
You'll always be
correct.
able to speak to a clinical staff member there.
That's right.
Can you still prevent from spreading COVID-19 just by coughing into your sleeve and washing your hands?
So yes, we all have to do our part in preventing the spread of this virus. So yes, hand washing with soap and water, hand sanitizers with alcohol, coughing appropriately is going to go a long way to help prevent spreading this virus to our friends, family, and the community.
So let's talk about testing for COVID-19. When is testing appropriate? When would somebody require a test for it?
Sure. So your provider, your physician, would determine the appropriateness of the test based on your risk factors. Have you been exposed to somebody who actually has COVID-19? And your symptoms. And of course, the availability of testing. The highest risk factor for someone developing COVID-19 is if they have had a prolonged and close, less than 6 feet, distance to somebody who has been proven to have COVID-19 disease. We're also in the process of developing drive-through testing stations, and we'll share more information as that becomes available.
Perfect. Why wouldn't somebody get a test if they have symptoms?
So just like any other tests, you want to assess the risk and the benefit of that test.
Okay.
Additionally, like I mentioned, availability of testing is another factor that goes into it. Hopefully, with more testing availability, we will not limit testing if someone has symptoms.
Why was it taking so long to get test results back? Is that not something that you can do in the hospital?
That's a great question. Initially, it took us about 5 to 7 days to get test results back from the commercial labs. Lately, we've seen those results to come back within 48 hours or so.
Oh, okay.
We are looking at capabilities of doing in-house testing, and hopefully that will result in a much shorter turnaround time for results.
So we've heard a lot of terms thrown around that we might not have been familiar with before since this has come about. So can you explain the difference between social distancing, self-isolation, and self-quarantine. And what is the difference?
Absolutely. So all these refer to a protective strategy to prevent the spread of the disease. So social distancing is a practice where we take certain actions to limit our contact with the community.
Yeah.
So we want to, and then the whole goal is to slow the spread of the disease.
Sure.
So we may be asked to work from home, stay at least 6 feet away from somebody next to you, visit loved ones electronically, avoid going to the gym, work out at home, and switching to online classes like a lot of the schools have done.
Okay.
Self-quarantine is recommended when you have been exposed to somebody with COVID-19 and want to prevent the risk of developing symptoms and spreading it to the community.
Okay.
You may be asked to stay at home, limit contact, avoid going to public spaces. Self-isolation is when you have been suspected through your symptoms, your risk factors of having COVID-19, or you have tested positive on a lab test with COVID-19, and are asked to stay away so that you can prevent spreading the virus.
And that's about 14 days is what you're usually asked to self-isolate, right?
Correct. The current recommendations are anywhere from 14 days, as the incubation period of the virus is 1 to 14 days.
Okay. So we talked about what social distancing is, but why is it so important? And we've also heard this phrase, flatten the curve. What does that mean?
So social distancing is important to mitigate the spread of the virus and is the best strategy to limit the impact and severity the virus will have on our community. The curve refers to the projected number of new cases over a period of time. Flatten the curve means to prevent the steep rise of coronavirus infections and have a more gradual increase of cases in order to avoid overburdening the healthcare system at one given time. So in short, the idea of flattening the curve is to stagger the number of new cases over a longer period of time so that people can get better access to medical care. And by slowing the rate of infection, medical providers would not exhaust the limited resources and equipment that we presently have. The power of social distancing is really important. So currently, one person with COVID-19 can spread it to 2 to 2.5 other people. Just imagine if these people then spread it to another 2 to 2.5 in 5 days, and that replicates. In 30 days, you've got over 400 people infected. By practicing social distancing, limiting exposure of the virus, staying away, staying home, can really have an impact on reducing the number who ultimately get infected.
How can people who are practicing social distancing, staying at home, but still need to go to the store, the pharmacy to get gas, practice those essential everyday tasks, how can we stay safe when we're doing that?
Sure. There are definitely certain things we could do to prevent the spread of the virus. For instance, if you go to the grocery store or gas station, when you come home, you may want to wash your hands with soap and water, for 20 seconds, or use hand sanitizer with at least 60% alcohol. You want to avoid touching your eyes, nose, and mouth with unwashed hands. Research has shown that we touch our face 16 times an hour.
Wow.
So avoiding that can go a long way. You want to, when you are out, you want to maintain a 6 feet distance from others around you. You want to frequently clean and disinfect objects, from doorknobs to light switches to faucets to tabletops. So
car handles, things like that.
Even grocery. When you bring your grocery in, if you've got certain containers, wipe them before you use them.
If somebody has an elderly parent that lives at home alone, and you really want to go visit them and you want to check on them and everything, how can you handle that to keep them safe and yourself safe?
Sure. Unfortunately, the best practice is to avoid in-person contact with them as much as possible, especially the elderly, because they're at a higher risk for developing complications. However, you definitely want to check on them either via telephone. They may not have access to television, internet, radio, and they may not be current on what's going on. You want to explain to them that the need for limited, contact with kids, grandkids, and you want to make sure that they have their medications, their food, and they stay hydrated.
What is Southwell doing to prevent the spread of COVID-19?
Okay, Southwell is taking every precaution, to prevent the spread of this virus. Our primary concern is our patients, our staff, visitors, our community. We have implemented a hotline that anyone can call to get any answers to questions that they may have. We are screening all visitors, employees, patients before they enter the building. Okay, we ask them about their travel history, their symptoms. We physically take their temperature so that we prevent somebody that may have the virus coming into the building. We have a dedicated COVID-19 committee that consists of medical and non-medical members. We assess our situation, look at our developing issues. We review the current available scientific information that we have, either from the CDC, Department of Health, and other resources, to modify and implement our policies and procedures. Staff that are taking care of patients who have COVID-19 wear full personal protective equipment, including gowns, gloves, masks, and goggles. And staff that has actually been in contact or exposed to somebody with COVID-19 are monitored and are appropriately placed under self-isolation or self-quarantine. We're also restricting visitors at this time to, prevent the spread of the virus.
And there's exceptions to that too.
Of course. There are some exceptions in certain situations.
One of the questions that we had was that somebody saw an article from the World Health Organization stating that you should not use ibuprofen to treat coronavirus. Is that true?
So based on the current available information, the WHO does not recommend against the use of ibuprofen.
Okay.
I guess based on no published research or data on the issue. I think the French health ministry had said that anti-inflammatories like ibuprofen, cortisone can worsen coronavirus infection. However, Tylenol has been the go-to drug for treatment of symptoms of coronavirus, especially because ibuprofen can result in side effects such as in the kidneys and such.
So one of the questions we received is if those who have pre-existing conditions are most at risk, including somebody with chronic respiratory failure, how would they be treated for this virus?
So firstly, we do not have an antiviral treatment for COVID-19.
Right.
And really the non-pharmacologic treatment is the same for all patients. However, patients with serious medical conditions like chronic respiratory failure may be more prone to complications, and treatment there would be geared towards treating those complications, such as pneumonia, acute respiratory distress syndrome, which would include antibiotics, putting them on mechanical ventilation, and providing supportive care.
Dr. Patel, thank you so much for joining us today.
Well, thank you, Liza, for allowing me to address these important questions from our community. I hope this empowers our community not to panic, but to make the right choices for our family and loved ones. Let's all do our part in preventing the spread of COVID-19.
For the most up-to-date information about COVID-19, we really encourage you to follow the Southwell Facebook page and also to visit our special COVID-19 page on our website at tiffregional.com/COVID-19. Don't forget to call our 24/7 hotline if you're experiencing any symptoms and to speak to a clinical staff member before visiting any of our facilities. That number is 877-719-5787. Thank you.